deadliest infectious diseases, and South Africa carries one of the highest burdens globally. Now, the country is taking a bold step forward. This week, South Africa is hosting a first-of-its-kind TB vaccine country preparedness workshop in Johannesburg, aiming to ensure the nation is ready to roll out a new generation of TB vaccines currently in late-stage development. Joining us now is Professor Norbert Ndjeka, Chief Director for Tuberculosis Control and Management within South Africa's Department of Health. And he's here to help us understand why this is such a key moment in the fight against TB, both here at home and globally. Professor Ndjeka, thank you for joining us. How are you on this Thursday?
I'm doing well, thank you. Thank you for inviting me.
Our pleasure. Thanks for making time. Professor, South Africa is hosting its first national TB Vaccine Preparedness Workshop. What's the main goal of this gathering?
Yeah, thank you so much for the question. So the reason why we organize this meeting is that we're taking advantage of being hosting the G20 this year. So we felt that we need to bring the issue of TB vaccine into the global agenda. Now, South Africa is a high-burden country in terms of tuberculosis, HIV, and even drug-resistant tuberculosis. We've been struggling with large numbers of patients who have TB, and half of the group of those who have tuberculosis are people living with HIV. And we're treating them, getting good results, but to really enhance the fight against tuberculosis, we need to cut down on new infections, and that's where the new vaccine comes in. So we've learned that there are a number of vaccine candidates, TB vaccine candidates that are at advanced stage, and we're making sure that when they become available, we should be among the first countries in the world to implement this in order to decrease TB transmission in our communities.
So how close are we to having these new TB vaccines ready for public use?
So the TB vaccines, the most advanced one is M72, and several research sites are in South Africa. We really contributed with a number of participants in clinical trials. Mm-hmm. This enrollment ended 12 months ahead of schedule. So we're looking forward to next 2-3 years. We think something will be available next 2 to 3 years. And that's really a short time because in the past, we've seen that, for example, when the first drug for tuberculosis, the first effective rifampicin was available, it took up to 10, 15, 20 years before the whole world got to use it. So this time around, we will no, we have to prepare because next 2 to 3 years, we could have something. So if we take again another 2 years, meaning that 5 years from now, 4 years, 3 to 5 years, we should have something implemented if it's available, yes.
How complex of a disease is tuberculosis? It seems like we were able to come up with COVID-19 vaccines pretty quickly. That's how it seems. But in terms of TB, we're still forming new vaccines.
Yeah, so in terms of TB, remember there's been this BCG vaccine that most of us got at birth. The old vaccine, BCG, very old, like, I don't know, 100 years or what. But we learned maybe 20 years ago that this is, or 15 years, I think, we learned that this is only protective for rare forms of tuberculosis, like your TB meningitis in children, things like that. So they've not been really an effective vaccine for tuberculosis. Research has been ongoing for the last, I would say, 20 years. I know there's a site in Worcester in the Western Cape that has been doing research for the last 20 years. But remember, TB has been well funded. COVID was funded because it affected the richest nations in the world. TB research has not been very well funded over the years, and that's one other reason why we feel we should escalate this to leadership, escalate this to the G20 group so that nations of the world could come together and give us resources to get this vaccine and use it among our people.
Right. So, unlike the BCG or the Bacillus calmette-guerin vaccine for TB, these new vaccines target adolescents and adults. Why is that shift critical?
So, adults are the one that transmit TB to children. So if you make sure that adults don't get TB, you will lower TB transmission. There will be if no adult is infected, there will be no children with that. So that's why it's important that we focus on adult and adolescents.
Let's talk about going back to COVID-19 then, in terms of their vaccine rollout or our vaccine rollout for COVID-19 plans. What lessons are we taking from that rollout plan in terms of informing this TB vaccine strategy? Are we?
Yeah, so we're getting a lot of lessons from COVID. Maybe let me just start by saying that although we are saying that COVID vaccination came very fast. Yes, I agree, but it's not entirely true because coronavirus or viruses existed, but COVID-19 was a different variant. And the old research on coronavirus contributed to the COVID-19 vaccine. So it wasn't like 2 years knowledge. There was some work done. So we really take that as a first lesson from COVID, but also we know that we struggle to get adults because traditionally vaccination is for children in our communities, and our immunization programs in various countries are geared towards vaccinating children. So with COVID, we really struggle to get adults, to get adolescents. We struggled with issues of misinformation, stigma. Some people didn't want to get the vaccine because they heard that this is not good for them. So a lot of issues in terms of platforms for delivery of vaccines, around misinformation, around getting people to understand is a problem, getting leadership, getting the right political will. So all these are things that we learn from COVID, and also we're more effective now in communicating ahead to leadership and mobilizing all the resources that we need.
How is the department planning to ensure the country is ready for a rollout in terms of starting from supply chains to health worker training?
So the department has been working on this. We do have our strategic plan, national strategic plan for HIV, TB, sexually transmitted infections, and hepatitis. So within this strategy for 2025, 2030, we do have clear guidelines, clear guidance on how this is going to be done. TB strategic plan is in place. And we've started by establishing a national advisory group on immunization because we need to be thinking, we need our academia, we need our experts to review available evidence from around the world. We won't use it just because someone said this works, this will work for South Africa. So this structure is in place. They're looking at it. We're looking at the regulatory authority, the South African Health Product Regulatory Authority, to say this is coming, and we want you to prioritize this in future. And the gathering that we're having from yesterday till today, we're beginning to think in terms of how will we finance this? How will our people get access to this? What are the considerations? How do we improve the existing immunization platform so that it includes adults and all this? How do we get more funds from National Treasury? And we also invited local manufacturers because we believe if they manufacture locally, access will also be improved. Pricing is critical. So these are the various issues that we are discussing, and we are among the first countries in the world. We know Indonesia did this exercise last year, and we're doing it this year, and we're very excited that a lot of ideas are coming out. We got traditional leadership in the room when we discuss this. We got church leaders, and it's really exciting to hear various perspectives, including civil society.
Professor Ndjeka, we appreciate your time again. We'll leave it there for this chat for today. Thanks.
Thank you so much.
Professor Norbert Ndjeka.